Good morning, everyone, and welcome to the second session within the webinar series the Center for Social Sciences Research and Action is holding under the headline of the Politics of Social Justice in Lebanon between Citizenship, Compounding Crisis, and Identities. Allow me to remind you that we have interpretation services in case you need them. And then at the end of our webinar, it will be, we will have a space for a Q&A discussion. So all of the questions or all of the comments you would like to make, please write them down or write them in the chat, and we will have the time to discuss them together. So this webinar, as you all know, will tackle informality in the Lebanese labor market with two experts on the topic whom I will introduce in a few. Informality or the phenomenon of informality is of particular importance to be unpacked in Lebanon, especially when the social protection system and the social security system is structurally linked to employment, linked to informal employment, excuse me. So in other words, the social protection system as it is today excludes large portions of workers, such as, for instance, agricultural workers, domestic workers, daily workers, construction workers, and so forth, in addition to self-employed, among others. Also, among those who are strictly and closely affected by this phenomenon are refugees, and their situation, without any doubt, has worsened with the compounding crisis Lebanon has been passing through for the past 3 years. As we all know, many informal workers were dismissed, or their salary have been cut, or even their working hours, and they do not benefit from legal protections which are afforded to formal employment. Also, as it will be surely discussed during the session, they do not have any healthcare coverage, or access in other cases is very limited. So in this session, as I have anticipated, we will unpack together with our speakers the phenomenon of informality in the Lebanese labor market. We are going to see together which categories are excluded from protection. We will assess as well the economic and social impacts of the compounding crisis the country has been passing through, and we will try to explore together with our speakers the ways to extend social protection to those excluded categories of workers. As I have mentioned, prepare all your questions, because after the presentations from our two speakers, we will have a Q&A discussion. So without any further delays, let me introduce our first speaker, Dr. Ahmad Dirany. He is a social researcher and a labor and union activist who has participated in many strikes, labor movements, and union activities. He is a former professor at the Lebanese University, the Faculty of Social Sciences, and he is currently the executive director of the Lebanese Observatory for the Rights of Workers and Employees. He has a PhD in social anthropology. Dr. Ahmad, تفضل. We are very happy to have you here with us. تفضل.
اوكي، شكرا جزيلا ستيفاني، وشكرا كمان الى اصدقائنا وزملائنا بمركز العلوم الاجتماعيه والابحاث التطبيقيه على الدعوه. اكيد مرحبا كل الموجودين والمشاركين اليوم، اللي بالرغم من انه ماني شايف اسمائهم وصورهم مين هن، بس بعتقد اكيد يعني فئه وناشطين ومهتمين بالموضوع اللي بدنا نتحدث عنه. مثل ما تفضلتي ولفتي نظري، هختصر بشكل كثير قد ما بقدر. يعني سألتزم بالوقت المحدد اللي هو 10 أو 12 دقيقة لنتحدث عن العمل النظامي. بالبداية بالاختصار اللي حاعمله اكيد بدنا نعوض عنه خلال الحوار بالاسئله والاجوبه، ونعوض عن اي شيء ما تحدثنا فيه كما يلي. اولا بالنسبه لما يسمى العمل الغير نظامي الانفورمال سيكتور، يعني خلينا نقول منبته او يعني النبع الاساسي لهذه الظاهره اذا بدنا نسميها لابد انه يعني الواحد يوقف قدام مساله لارتباط هذه الظاهره بشيء اللي اسمه النظام الراسمالي الاقتصادي العالمي. لا نستطيع انه نقدر نتحدث عن العمل النظامي، العمل بحد ذاته هو ركن من اركان النظام الرسمي. العمل اذا بدنا نيجي نحكي نحن فيه هون يرتبط فيها، لانه بنعرف نحن منحى الاجمالي العام للراسماليه هو دائما تخفيف الكلفه التشغيليه عليها، ودائما الانظمه عودتنا بكثير من الحركات والتحركات تخفيف الكلفه التشغيليه عليها بانتاج اي سلعه عم تعملها، انه بتروح دغري على المترتبات الاجتماعيه لقضيه العمل، من الضمانات للاجور الى اخره بهذا المعنى. وهذه الظاهره شفنا نحن عليها تحركات متعدده مؤخرا باكثر من بلد. فهذا اول شغله. الشغله الثانيه واساسا يعني نحن قبل يعني بالمراحل الاولى من نمو الراسماليه ووجودها كان هناك الغالبيه العظمى من العمل في المعامل والمصانع هي كانت تقريبا اقرب للسخره والعبيد. اجت دوله الرعايه الاجتماعيه والقوانين والنضالات لتعمل بالاخير متغيرات عم نلاقي نحن بالفتره الراهنه ارتداد عن ما يسمى دوله الرعايه الاجتماعيه. ودوله الرعايه الاجتماعيه بدي اشير لابرز نقطه بتهمنا نحن بقعدتنا اليوم، اللي هي مساله عقود العمل. هناك اتجاه عالمي اذا بدنا نشوفه يعني نتابعوه كلكم سوا، انه يعني الخلاص من عقد العمل الاساسي الرئيسي اللي هو عقد العمل المحمي اجتماعيا الذي يترتب عليه ضمانات، بيترتب عليه تعويض نهايه خدمه، بيترتب عليه تقديمات تعليميه صحيه الى اخره، اليات في زيادات الاجور الى اخره من هذه المسائل. هذا ما يتم الان محاوله الخلاص منه يعني على حتى على المستوى العالمي بهالمعنى هذا. المحاولة للخلاص من عقد العمل كلكم صرتوا تعرفوا انه صار في عندنا عقد العمل المؤقت، عقد العمل الجزئي، العمل عن بعد، الفريلانس الى اخره، كل هذه الاشكال اللي بالنهايه تنتهي عقود عمل غير محميه اجتماعيا للمقدمات. وهون هيدا المنبت على رح اتفق بهالقدر، وبتصور اكيد زميلتي ليا الدكتوره ليا كمان على المستوى الدولي العالمي حيكون عندنا مداخله نستفيد منها اكثر بهالمجال هذا. بدي اجي دغري لانزل على لبنان لنحكي نحن على الواقع اللبناني شو اللي عم يتم عندنا. اولا كمان بلبنان لابد انه نقول نحن طبيعه الاقتصاد الريعي عندنا نحن في لبنان اللي ما بيعتمد الاقتصاد منتج زراعي وصناعي الى اخره لا يوفر فرص عمل كافيه، فبالتالي عم بيكون في عندنا سوق عندنا بطاله مرتفعه اساسا في لبنان، عدا عن ازمه الانهيار المالي والاقتصادي اليوم في عندنا الازمه هذه. هذه ثاني نقطه اللي حابب اشير لها، عندنا بالنسبه ظاهره العمل يعني العمل الغير نظامي هي موجوده في قطاع، في كلا القطاعين العام والخاص. في العام بدي اقول انه شو سببها في العام، يعني نحن بالعام في عندنا شاهدنا في لبنان مؤخرا وما زالت هي ظاهره موجوده، عندنا نحن العمال الميومين كانوا بالكهرباء، عندنا الميومين في البلديات، عندنا المتعاقدين في وزارات الدوله المختلفه، عندنا المتعاقدين في التعليم. طيب ليه عندنا هذا الكم؟ وعم نحكي عن هون يعني اعداد، يعني بالتعليم فقط نعطي مثال فوق 30,000 متعاقد ما بياخذوا، ما عندهم ضمانات، ما عندهم تعويضات، ما في نهايه خدمه، ما في تعليم، ما في نقل، ما في شيء، يمكن بس النقل اذا كانوا عم يعطوهم ولا. لماذا هذه الظاهره؟ لانه نحن نعاني، يعني كان هناك تعاطي من المنظومه الحاكمه في لبنان بطرفيها، وخاصه هذه باخر التسعينات برزت عنا قبل يعني بنهايه القرن السابق، انه هذه الدوله اللبنانيه يعني نحن الاداره اللبنانيه تعاطوا فيها، كان عندنا مقاربتين يتعاطوا معها فيها، عندنا الزعماء السياسيين او القطاع السياسي او المرجعيات الطائفيه او الزعماء السياسيين الطائفيين من ماي، وعندنا النيوليبراليه اللي كانت موجوده في لبنان من ماي. اثنينهم استهدفوا القطاع العام وخربوا القطاع العام. النيوليبراليه انه كان خلاص من القطاع العام بيكون كثير منيح، فطلع قرار ممنوع التوظيف على طريقه محليه. كيفوا الاخوان هوليك الاخرين الزعامات والارباب الزبائنيه كيفوا عليها انه اوكي صرنا نحن، صارت الدوله والاداره اللبنانيه مزرعه لهم، وانفلشت وانفجر بالون او يعني هالانفجار للعمل، التعاقد، العمل المياوم الى اخره. هون كانت هذه يعني الخلفيه اللي خلت عندنا هالانفجار هيدا بعمل اليومي. وايضا يعني بالرغم من كل القرارات كانت اتخذها الدوله اللبنانيه، يعني على الاقل بالانتخابات النيابيه الاخيره او قبل الانتخابات، يعني قبل انفجار الانتفاضه ب 17 19 ب 18 اتخذ قرار انه يمنع التوظيف في الدوله بس كان في انتخابات. ده بيمنح التوظيف 11,000 بني ادم توظفوهم بالدوله بدون يعني عقود عمل، بدون مجلس خدمه، بدون الى اخره كمان. فدائما عم تتفاقم بهذا النهج السياسي وهذا النهج الاقتصادي اذا بدنا نشير له. هيدي يعني عم بعمل نقاط ما عم بتوسع كثير فيهم وبالحوار اكيد بنقدر نتوسع اكثر واكثر. طيب ايضا في عامل يعني نقطه اساسيه بدي اشير لها، عندنا نحن في لبنان نظام الحمايه الاجتماعيه يرتبط بالعمل النظامي. نحن لا يعني بالاخير لانه يقوم على الاشتراكات مش على التكافل الاجتماعي ومسؤوليه الدوله في هذا الامر. فبالتالي ساعات نيجي نحن نقول انه طيب لا يرتبط بالعمل النظامي. نحن بنعرف اساسا باحصاءات الضمان الاجتماعي اللي هو بيقولها اذا نحن عندنا القوى العامله في لبنان تقريبا تتراوح بين 1,400,000 ل 1,700,000. طيب الضمان بيقول في عندي بالكاد 47 48 منتسبين الى الضمان. يعني معناتها ديجا سنه بدنا نخصم هوديك كلهم صاروا بلا ضمان اجتماعي، بلا تعويض نهايه خدمه، بلا مرض، بلا امومي، بلا الى اخره في هالمعنى هذا. طيب هذه اذا اخذنا الضمان. وسائر صناديق الضمان كله يرتبط بالعمل النظامي. طيب ما هو واقع الفئات الثانيه؟ حدث ولا حرج، فيكم تتصوروا شو عم بيكون عم بيصير فيهم بهذا المعنى. هلا هون المفترض انه يكون في تسكير نسبي من وزارتين معنيين، هن وزاره الصحه ووزاره الشؤون الاجتماعيه. وزاره الشؤون الاجتماعيه تتعاطى الحسنه وتوزيع المساعدات وتوزيع بتواطؤ مع السياسات الدوليه اللي كان البنك الدولي او غيره، بيجيبوا لنا مصاري، بيوزعوا حسنات وصدقات، مش بينفات بمشاريع استثماريه تخلق فرص عمل بهالمعنى. وايضا وزاره الصحه كمان بتقديماتها ما بتقدر تغطي هذا الفجوه الكبيره بالرعايه الاجتماعيه اللي ناتجه عن ارتباطها بالعمل النظامي بهالمعنى هذا. فلذلك هون نحن بتصير عندنا هون نقطة أيضا إضافية بدي أقولها بالقوانين اللبنانية. عندنا بقانون العمل اللبناني لمعلوماتنا عندنا المادة 7 وهذه مادة قانون بدنا نطبق القانون بيقولها إنه يستثنى من أحكام قانون العمل اللبناني. المادة 7 بتقول العاملين في الزراعة، العاملين في الخدمة المنزلية، الميومين والمستخدمين الموجودين في المؤسسات والادارات العامه، العمل المنزلي والاعمال المؤقته. فديجا دغري يعني خبطنا نحن هون عشرات الالاف من القوى العامله خارج بقوه القانون، مش بالزعبره اللي بتعملها الراسماليه وارباب العمل، صاروا عندنا هول برا. فهيدي بتتحمل مسؤوليه عن هذه الظاهره بهالمعنى. طيب عندنا نحن خلينا نشوفه. طيب بالزمن الانهيار اللي نحن موجودين فيه اليوم، طيب بنعرف يعني الانهيار المالي الاقتصادي اللي نحن كل عملنا ونشاطنا اليوم نتعاطى معه على قاعده انه نحن اليوم نعيش زمن الانهيار. هذا زمن الانهيار شو اللي عمل عندنا؟ اولا الاحصاءات العاطلين عن العمل لا تقل عن 500 إلى 600 ألف عامل، يعني تجاوزت 50 60% نسبة البطالة. طيب هذه البطالة هل هناك يا ترى عندنا نظام حماية للبطالة؟ بلبنان لا، ما في عندنا نظام حماية للبطالة بهذا المعنى. فهول متروكين كليا بلا أي حماية، بلا أي ضمانات، بلا أي شيء بهالمعنى. وبذات الوقت إذا جينا لنحكي بصندوق بطالة، يعني كنا من شوي عم نتحدث مع زميلتي ليا الدكتورة ليا، لأنه كمان نحن بصناديق البطالة اللي كانت عم تنطرح أيضا ترتبط بالعمل النظامي لأنه قائمة على الاشتراكات. يعني برضه نحن في عندنا مشكلة هون بطبيعة الحماية الاجتماعية، والحمايات الاجتماعية اللي بدها تنعمل إنه فيها فجوات كثيرة بدها إعادة نظر وشغل عليها. طيب إذا بدنا نيجي نقول نحن على مستوى هالظاهره هذه نيجي نشوف واقع العماله الاجتماعيه اللي عم نحكي عنها، عفوا العمل الغير نظامي. مثل ما سبق ذكرت اذا نحن عندنا 1,400,000 ل 1,700,000 قوى العامله. طيب نحن بالمناسبه قبل الانهيار المالي باحصاءات متابعه عندنا نحن كمرصد عندنا ما لا يقل عن 1,200,000 عامل غير لبناني، بين عماله فلسطينيه، بين عاملات المنزليه، بين العمال المهاجرين، جزء من العمال السوريين لانه السوريين وجودهم في البلد في النازحين بسبب الحرب، وفي اللي كانوا بسبب العمل اللي ما بيتجاوزوش ل 400-500 ألف. فبالتالي عندنا 1,200,000 هذه البلوك. طيب وعندنا على مستوى القطاعات اللبنانيه، يعني مثلا كانت احصاءات كفى انه عندنا بحدود 350,000 عامله منزليه قبل الحرب، اللي اجى الانهيار لا يطيح بفوق ال 150 200، يعني في عدد ما عندي الرقم الفعلي، اللي رجعوا فلوا وتركوا البلد بسبب الانهيار الحاصل اللي عم يصير له. ما هو واقع الحمايات الاجتماعيه لهي الفئات؟ اذا بدنا ناخذ نحن العمال الفلسطينيين، بعدهم لليوم العمال الفلسطينيه بيعانوا منعهم من العمل في نقابات المهن الحره، يعني مهندسين، محامين، اطباء والى اخره. طيب، وايضا في مهن عديده متعدده ثانيه اخرى ما مش حق فيها، والمهن الرسميه ولا مش حق فيها. طيب، تحت حجه انه هنهم بشكل منافس، الى ان تاتي بالاخير الدراسه اللي عملتها لجنه الحوار اللبناني الفلسطيني، اللي تقول عندنا يعني عندنا حركه 170,000 بني ادم يعني الفلسطينيين، وصارت تقديرات القوى العامله اللي فيهم ما بيتجاوزوا، اذا اخذنا سن العمل ممكن يتجاوز 30 ل 40,000. طيب، من هالمليون و200 في عندنا 30,000 فلسطيني، يعني هول اللي بدهم يعملوا الازمه في لبنان عفوا. وبالتالي اذا عم نحكي عن العميل الفلسطيني بعده بده اجازه عمل، عدم ممنوعين، قال تكرموا عليهم سجلوهم بالضمان، ملزم يتسجل بالضمان. طيب بيروح يتسجل بالضمان بيستفيد فقط من نهايه الخدمه، تعويض نهايه الخدمه، ما له حق لا بطبابه لا بالضمان لا بعائله لا بتعويض عائله ولا باي شيء. طيب هذا واقع اللي عم يعيشه العماله الفلسطينيه. العماله المهاجره، طيب عندنا هونيك كمان البالون الكبير المرعب، انه ملزم بحكم القانون انه طيب اذا انا او ستيفانيا او اي حدا منكم بده يجيب عامل بدنا نسجله بالضمان، بدنا ندفع عليه اشتراكات الصحه والتعويض العائلي وتعويض نهايه الخدمه على الفروع الثلاثه. طيب ولا يستفيد بالمطلق، لا يستفيد بالمطلق، هذا خلافا لكل المعاهدات الدوليه اللي بتنص عليها منظمه العمل الدوليه ولا كل معاهدات حقوق الانسان من دول. طيب بالاخير طيب انا عم بدفع، اعطوني ابي اللي عم بدفعه. لا يعترف القانون اللبناني بذلك تحت حجه المعامله بالمثل وهي مساله سخيفه جدا، لانه وهذه مش موجوده في بلدان العالم. طالما هذا العامل دخل بشكل قانوني، اخذ اقامه، اخذ بناء على عقد عمل، بناء على الاشتراك، ما هو اللي رتبهم صار بالاخير يحق له ما يحق للبناني. لماذا لا يعطى بالاخير هذه الضمانات اللي نحن عم نشير لها بهالمعنى هذا؟ فعندنا العماله المنزليه مش رح نحكي كثير فيها، بتصور كثير حكيين فيها، وبنعرف انه بالاخير اسوء انواع الاستغلال البشري عم بيتم العمليات المنزليه، نظام الكفاله انه لكفت ووفت بالاخير. انه من فتره عندنا بلبنان انه مش عارف كيف الله نزل الوحي عليهم جماعه هذه الوزيره يمين، انه راحوا عملوا مع الاي ال او بعتقد واشتغلوا وعملوا عقد عمل موحد ومشوا عم ينفذوا. بيطلعوا المافيا المتحكمه بسوق العاملات المنزليات مكاتب الاستخدام بيعملوا دعوه بمجلس الشورى الدولي، ويستجيب مجلس الشورى الدولي ويوقف العمل بهذا العقد اللي اعطى شويه هيك تحسينات من نوع فرصه، من نوع الحد الادنى للاجور، من نوع ساعات العمل، يعني في محاوله تحسين اذا لا يطيح فيها. وهذه هي بالمناسبه هي مكاتب غير شرعيه، لأنه وجود هذه المكاتب هي يتنافى مع مبدأ وجود المؤسسة الوطنية للاستخدام التي تنص قانون إنشائها منع وجود مكاتب استخدام على الأراضي اللبنانية كافة بوجودها هي. كل اللي عملوه احتالوا على القانون انه شالوا كلمة خاء حطوا قاف، مش استخدام استقدام. فهي السخافة اللي واصلة نحن ولادي كنا عم نحاول بدنا نبقى نعمل معركة طعن قانوني فيها ونشوف بعدين إذا بنقدر. يعني انا حاكتفي بهاللي قدمتهم. اكيد في مجال الواحد يتوسع باكثر من نقطه بنظام الحمايه، شو اللي بدنا نعمله، خاصه هلا بعد ما بنتحدث زميلتي الدكتوره ليا عن الحمايه الاجتماعيه، انه عم نشتغل نحن ان كان كمرصد او مع شبكه ماي وورك ماي رايت على ورش متعدده تحت عنوان الحمايه الاجتماعيه الشامله للجميع. شكرا لكم.
شكرا دكتور أحمد. Indeed it was a very inclusive presentation.
طالما كنت طولت التزمت بالوقت.
لا ما في. ميرسي، شكرا لك لأنك قدرت تعطينا يعني بفترة أكيد كتير قصيرة صورة عامة وكمان ديتيلد فينا نقول عن الوضع العمل الغير نظامي بلبنان، إن كان من ناحية القانونية إن كان من ناحية عملية، وشو هن الضمانات اللي مش موجودين يعني بالأصل، وخصوصاً أعطيتنا كمان فكرة معمقة عن يلي عم بيصير لنقول الحالة يلي صارت أسوأ بكتير، خصوصاً مع الايكونوميك ديبريشن يلي قاطع فيها لبنان، ويلي unfortunately مش شايفين بعد لهلا يعني exit tunnel. So without further delays, I will move to our second speaker, Dr. Leah Abu Khater. So Dr. Leah Abu Khater is a social protection technical officer at the International Labour Organization Regional Office of the Arab States. She holds a PhD in development studies. Thank you, Dr. Abu Khater, for accepting our invitation. Please go ahead.
Thank you. Can you hear me well?
Yes, we can hear you.
Good morning, everyone. Thank you for the center for this invitation to discuss this extremely relevant issue today. Dr. Ahmad focused on, the political economy, the structural reasons. I will try to complement this with a more technical approach to the challenges and opportunities of extending social security for workers in the informal economy. I will use social security and social protection interchangeably. So as we know, the COVID pandemic and its economic impacts have exposed the vulnerabilities of workers in the informal economy who lack adequate social protection coverage. And in the absence of this income security and effective access to healthcare, many workers in the informal economy face existential struggles. I would want to first just give a small snapshot on the importance of the approach of the ILO to social security. Now, I don't know if you know, the ILO is the first UN organization that was created in 1919 at the end of World War I to reflect the belief, and this is important, that universal and lasting peace can be accomplished only if it's based on social justice. The ILO is also one of its kind because it has a tripartite organization that brings together government, representatives of governments, employers, and workers in the executive bodies. And since 1919, and on the basis of a very clear constitution, the ILO has developed a coherent framework, the standards that guide the establishment, the development, the maintenance of social security systems across the world. And this is, where the importance of this perspective comes from. I will start with what is social security, because often we found ourselves having a different, conception of what social security is. So just to make sure that we're, talking about the same thing. And in order also to simplify it, because this is a term that is not, I would say mainstream. People face different risks across their lives, such as maternity, ill health, and this is, what you can see on the top right of your screen, sickness, unemployment, work injury, invalidity, old age, death of the breadwinners. And these are the 9 main risks that ILO, perceive to put an end to or cause substantial reduction of their income. So these are the risks that put at risk the income security. So against this background, the ILO defines social protection as the protection that society provides for its members against these contingencies. So first, to compensate for this lost income caused by these 9 contingencies, and to facilitate access to social services such as health services, education, and others. So when we talk about social security or social protection, again, interchangeably, we don't mean health, but to facilitate access to social services such as health. And social protection can be, provided under 2 main schemes. And as Dr. Ahmad was saying, we tend to focus on the protection of workers through contributory schemes. And when we say contributory, these are schemes in which, to simplify it, in which the benefit is directly linked to the contributions the beneficiary has made previously. So in the case of Lebanon, you contribute to the NSSF and you get a protection from the NSSF. Non-contributory schemes are schemes that normally require no direct contribution from the beneficiaries or their employers as a condition to receive, social transfers. The term covers a broad range of schemes, whether it's universal, so for everyone, categorical, so you focus on certain categories, or means-tested schemes, so you target a specific category or a specific group of people. In this case, for instance, in Lebanon, the famous National Poverty Targeting Plan. So these non-contributory schemes are financed, so as we said, not by contributions, but instead mostly by taxes, state revenues, and sometimes external grants and loans. As I mentioned before, excuse me. So the ILO has, a normative framework. Has this normative framework that would, guide and give the main principles of what social protection is and how we can provide it. But it does not have a one-size-fits-all solution, which is luckily. So the main conventions is the Convention 102 that can give us the guidelines and the main principles. And this is the flagship convention. So as again, the Social Security standards build on the idea that there is no unique model for Social Security, but rather common fundamental principles that you can find in the conventions. If you want to talk about Lebanon, but briefly, because this is not, specifically our topic, social protection, but rather the extension of social protection to workers in the informal employment. And previously, the center has hosted the ILO, where we, discussed this topic extensively. So if you want just to give a snapshot about, the coverage in Lebanon, before the crisis, these are the numbers that we have. 53% of the population were affiliated with social insurance in Lebanon. And if you see the figure, you can see that more than 70% of those affiliated with social insurance schemes belong to the upper half of the income distribution. So everything in blue is rather on the, the richest side of our spectrum. So the largest share of those affiliated to social insurance, and by social insurance, we mean contributory, for example, the NSSF. So the highest share of affiliated are rather, on the right side of the spectrum that you can see from green to blue. And also the highest share of beneficiaries are from this category, and also the largest share of benefits go to this category, which is in itself, problematic. And if you want to look at the sectors, we can see that only 1 in 10 of all workers in agriculture and construction have access to employment-related social insurance. And when they don't have that, they are in the informal economy. If we look again at the situation in Lebanon, you can see, for instance, on the left of this of the graph, this is social assistance, contributory, non-contributory type of assistance to the poor, like the famous National Poverty Targeting Plan that targets the most vulnerable categories. And on the extreme right, you can see those who are protected through their employment, through the National Social Security Fund that provide end-of-service indemnities, health insurance, family allowances. This is the orange part. On top of it, there are categories of people who can afford to top this up or to have it independently as a voluntary private insurance. So we find that on the extreme left, on the extreme right, people are protected. But there is in the middle, people who don't qualify for poverty targeting programs, let's say, and who don't have any formal employment and in turn do not have any protection at all. This missing middle, a large number of it is the informally employed. And this is why we have to discuss how to protect this missing middle. But also, what is the informal economy? Because I also saw a question on the chat, someone asking about what domestic workers, they fall under kafala system, are they informal or formal? the definition that we adopted at the ILO is that all economic activities by workers and economic units, so enterprises that are in law or in practice not covered or insufficiently governed by formal arrangements. And here, to go more into details, we have to talk about three categories: employees, employers, and contributing family workers. An employee is considered informally employed if the employer does not contribute to Social Security on their behalf, or if the employee does not benefit from paid leave or sick leave. An employer can also be in the informal economy. An employer, which is an individual that hires people, hires workers, and self-employed, so people that are self-employed but do not hire people, this is the difference between employer and self-employed, they are considered informally employed if he or she runs an economic unit in the informal sector, and in turn they have not incorporated their private enterprises, and they are without a formal bookkeeping system, so basically not registered with relevant authorities. In the case of Lebanon, with the Ministry of Economy, they don't have, a taxation form. One question is that, because we need to understand this is not exceptional to our region or to the global south, I would say, is informal economy a characteristic only of developing countries? And, as an echo to what Dr. Ahmad was saying about the repercussions of neoliberalism, this is not prevalent, this is not specific or exceptional in the region. It's true that it's more prevalent in developing countries, but in many countries, both developing and industrialized, informal employment exists. And there's a linkage between the change in the organization of work and the growth of the informal economy. So you can see that, for instance, in the map, the green parts and the light blue, between 10 to 15% of people in Europe working are in the informal employment, but this rises to, let's say, 99% in Asia. If you look at the Arab states, so if you look at the total, the world distribution, we have more than 60% of workers in the informal employment. For the Arab states, it goes up to 70%. If you want to talk about Lebanon, as you know, there is no historical data on informality in Lebanon because we don't have consistent data collection. In 2018, 2019, but this is not what you're seeing. What you're seeing is from another study that I will mention in a bit. But 2018, 2019, there was an estimate that around 874,000 informal workers in the Lebanese labor market. And the largest, so we can say that 58% of jobs were of workers that are not formally registered in the NSSF, and therefore they lack social security coverage, But now what you see in front of you is an infographic from a study, and I don't know if our colleagues from the center can post the link if you want to know more. It's a study that was done in 2021 called Assessing Informality and Vulnerability Among Disadvantaged Groups in Lebanon. This study focuses on workers in vulnerable cadastre in Lebanon. So they focused on vulnerable groups. It's not just a national survey, but these results are based on a survey of 5,000 households, so a total of 19,000 individuals, if you transform the household into individuals. But this shows us that more than 64% of these workers in Lebanon are in the informal economy. If we look at specifically at Syrian refugees and Palestinian refugees, it's more than 90% of them work in the informal economy. If we combine all together, we have 77% of our workforce in the informal economy. If you want to know more details on that, the report can give you much more details, but we don't have time. I'm afraid I'm running out of time. I hope not. So our main issue is how to extend social security to workers in the informal economy. As I said, I want to complement a bit the background of Dr. Ahmad with more of technical, issues. The barriers are first, if you want to say, the exclusion from legal coverage. And, as already mentioned, For instance, the exceptions under Article 7 of the Labor Code in Lebanon, for example, exclude agricultural workers, contributing family workers, and domestic workers, from the Labor Code. These workers are effectively denied access to social protection to the NSSF. There is also another impediment, which is the lack of trust in social security institution that can also contribute to a certain reluctance to join a social security system. Maybe there's no, enough confidence, let's say, in the NSSF, and people will be in turn demotivated from contributing and registering their also employees or employees demanding that. A very important impediment is the benefits tend to be not aligned with the priorities. Workers and employers may be reluctant to contribute if they are not convinced that the benefits provided will meet their priority needs. And here we need also a good design and also awareness on the benefits of social insurance schemes. A fourth one that is equally important is the costs and the inadequate financing arrangements. So contributions may not be adopted to the level of earned income and may be perceived as too high. And here it's not a coincidence, for instance, that agricultural workers are not included. It's their contribution capacity is limited. The way to collect contribution is difficult, and we're going to talk about it more. Another impediment is administrative procedures. Usually to register in social insurance, it is complex and burdensome, and it may also discourage from registration. One final impediment that I will mention that probably Dr. Ahmad will like is the lack of representation in organizations. It is widely acknowledged that there's a direct link between the workers' organization's capacity and the ease of including them in contributory schemes, meaning that the lack of organization of some categories of workers, of which agricultural workers, domestic workers, work platform workers, makes them more marginalized and reduce their chances of being represented in open debates, in demand of these human rights. And here you can see in the graph how when you have formal employment, to what extent the level of protection is high, and when you have informal employment, to what extent it's really limited. The question before we talk about how to extend, I think in our discourse and our dialogues, it is important to kind of build a business case and to tell the different, constituencies, how do they benefit from this extension? We have to have this conversation with workers, with enterprises, with societies. How is this beneficial? So for workers, the workers would benefit from effective access to healthcare, higher levels of income security. So for instance, in case there is unemployment, they would benefit from an employment insurance scheme, which contribute to reducing poverty. So it gives security to their income. Again, we go back to the initial contingencies that we discussed, we discussed in the beginning. And this would contribute to reduce poverty, to enhance their well-being, and reduce decent work deficits. For enterprises, which is also very important to tabulate, I would say, enterprises would benefit from higher labor productivity and competitiveness through improved health, higher employee retention, higher motivation, and most importantly, they would benefit from the pooling of financial risks altogether that are associated with employer liability in the case of work injury, sickness, maternity. So contributing altogether to one fund, is very beneficial to all. For societies, they would benefit from achieving a better financing mix for the social protection system because they are mobilizing additional financing sources from these previously informal of these workers that you would include in your social insurance. So you're bringing in, more financial resources, and this alleviates pressures on the non-contributory schemes. So instead of having more pressure on these tax finance schemes, including these workers in social insurance funds, again, contributory, would alleviate the pressure on these tax financed assistance. Now, how can we extend coverage to workers in the informal employment? Again, we don't have...
I'm sorry, Dr. Leah, to interrupt you. No, if you can just wrap up, please, in 2 to 3 minutes.
Yes, this maximum. Is the main point, though. I just need 2 more minutes. Okay, so if we look in best practices, we have two different approaches, and that they are represented in the graph. So the first one is the dark blue, where you have this arrow going to the left. You would include workers in social protection through formalization, focusing on existing contributory schemes. In our case, for instance, the NSSF, you would bring in agricultural workers who, by the way, the social insurance law had provided their inclusion, but this is not implemented. So you would bring them in. This approach will prioritize workers that are close to the formal economy. You would just bring them in, but they will have to have a contributory capacity. So we would want to assume that these agricultural workers will be capable to pay a certain contribution. We have to also, of course, calculate how much can they pay, how are we going to collect it, etc. And so this is the arrow that goes to the left to bring some people in. But there's also this arrow that goes upwards, which is another approach that would focus on providing assistance to people to extend this non-contributory mechanism, this assistance that is tax financed again, regardless of your employment status. So you would be, covering, and here we talk about our social protection floor, you would increase the coverage of people regardless of their status. So you would provide, let's say, protection for ill health, for old age, etc. So you would give them a protection regardless of their status, and in turn, informal workers would benefit from that. There's also a video that you can see from an example of how Namibia did this to extend coverage to informal workers, and probably, I don't know if they will post it for you on the chat. So this is, so based on these two approaches, we want to say that there is no one size fits all solution. What we recommend is that to have an integrated two-track approach to work on through these two tracks, okay? And this is reflected, the coverage through these two tracks in an integrated way is, the guidelines of that are available in recommendation 202, recommendation 204 that you can also find. But this is basically what you see in front of you here on the right is exactly to move in the two tracks to bring people through formalization, and in turn provide them with coverage through social insurance, so through their employment, but also independently of their status, to also give them protection against the 9 contingencies, in a tax financed way. So these two tracks working together, based on the experience, would provide the best protection. One more minute. This is if you want also, there are guidelines on how to formulate strategies to include these workers, and there's a package that the ILO has developed that gives you all the details on, guidelines and principles, and also we can maybe put it in the chat. This is kind of, the cycle. It's not a straightjacketed approach, of course, but it also helps. But what's important maybe I don't know if we can later on share, but I also gave some examples of how to extend coverage to domestic workers. So basically, to extend legal coverage, we need to include them in the labor code, and this Article 7 needs to, be addressed. We have to facilitate their access by removing administrative barriers, and we have to, and this is very important, we tend to think that this is an easy thing to include all types of workers in social insurance. We have to understand that we need to collect the contributions from workers and employers. We have to have flexible collection mechanisms that are tailored to different groups. So domestic workers have different specificities than agricultural workers, and we need to target that to address this in our design. We can even subsidize the contribution. And here the last point, we can even give fiscal incentives for employers who register domestic workers, and this will increase registration. I did the same for agricultural workers, but we don't have time, I suppose. But just to say that there is an attempt or a legal work around a proposal how to include agricultural workers in the NSSF, and there is a bill that is being discussed on how to include them. They are initially in the social insurance law. The lesson learned, I think.
I'm sorry, Dr.
You can read that in the literature I mentioned. Thank you.
I'm sorry to interrupt you, but we need to leave a bit of space for the Q&A discussion. And obviously, you can mention the points whenever now we open the floor. So I encourage now, first of all, thank you for this exhaustive presentation. It was really informative. And also we have put the links which Dr. Leah talked about in the chat. And then we have a question regarding, Rita asked if there will be a video. I inform all the participants that all our webinar sessions are then posted on our YouTube channel. So in case you would like to go through again the session and what the speakers have presented, you can find it on our YouTube channel. Obviously, there should be some time between the happening of the session and we usually post it just a few weeks later. So thank you again for the speakers. I think we have collected a bit of some questions actually. So we have a question from Martin Beck. Who asks about actually the domestic workers in Lebanon. And he says that it was mentioned that domestic workers in Lebanon are part of the informal sector. However, many of them are employed by the kafala system. As this system is highly bureaucratized, is domestic work based on the kafala system to be considered part of the informal sector? I don't know who of our two speakers would like to respond to this, Dr. Ahmad or Dr. Leah? If you need me also, Dr. Ahmad, to translate the question, no problem.
بدك تحاولي تجمعي أسئلة ولا سؤال بنشتغل؟
فينا نشتغل سؤال. فينا نشتغل سؤال.
طيب أوكي تفضلي من بعدك ليا. ما في مشكلة.
Okay. Okay. Of course, domestic workers is a group that is very specific. But to say that they are covered by the kafala system would be, I would say, not the right statement, because the kafala system is not really a system. It's just a set of, rules and decisions that regulate the entry and the exit of domestic workers. When we see clearly in Article 7 of the Labor Code that they are excluded from any labor protection, we can say that they are in the informal employment or informal economy, I would say.
تفضل دكتور أحمد. Thank you.
بدك تزيد شيء على الجواب؟ يمكن أنت تعرف أكثر.
لا اللي تفضلت فيه الدكتوره ليا كيف يعني بعتبره كيف، لانه مثل ما قالت تماما النظام الكفيل مش نظام ضمانات، مش نظام حمايه، هو نظام طبيعه علاقه العمل اللي هو ده ماشي بكثير من البلدان خاصه البلدان العربيه، انه بالاخير استتباع شخصي واستعباد وربط شيء بشع جدا، يعني يوصف بكثير من الادبيات هذا النظام استعباد الكفاله يعني بهالمعنى اكيد ان في القطاع الغير نظامي، لانه ما في ضمان، ما في تعويضات، ما في شيء، ما فيش لا حمايه اجتماعيه لنا. لا ما عندي اضافه عن اللي تفضلت فيه الدكتوره يعني.
Okay, thank you. We have another question also from Martin Beck, and he asks about what part of the labor force in Lebanon is part of the formal sector and what part is part of the informal sector. If we can specify more to our participants, who is actually considered today in Lebanon prevalently part of the formal sector and who prevalently of the informal. I think the informal we have specified it, but in case the speakers would like to outline it again. Go ahead, please.
If I may, the definition is okay. I would say rather clear, but if you want to implement it to the case of Lebanon, formal employment should have, if you are an employee, okay, because you have employee and employers and self-employed, and it's different across. So if you are an employee, you are considered formal if your employer contributes to social security for you. So in one type of social insurance is the NSSF, or if the employee benefits from paid annual leave and sick leave and have, falls under the labor code. If you are an employer, and here I want to say, you might be an employee working in the informal employment. You can be informal working for an informal enterprise. So your economic unit is registered, they have bookkeeping, but you as a worker, you are not covered in the NSSF. They don't pay contributions for you, and you don't benefit from any annual leave or sick leave, etc. So you are in the informal economy, although you work in an enterprise that is formal. And you have employers. The employers, which are people who hire workers, more than one by definition, and self-employed. So they have their own economic units. So the self-employed is his own economic unit, I would say, let's say, and the employer. So they are considered formal if, you know, they are registered at the national authorities, they do their bookkeeping and they have their taxations, but they can also employ people who are informal. So it's not very straitjacketed. And when you talk about contributing family workers, these are by definition working in the informal sector because they are not protected as well by the labor law. So if you want a percentage, we can say, I mean, the latest numbers that we have are from 2018, 2019, when I said, I think about 50% of the work, a bit more than 50 of the workforce is in informal employment. If you want to look at the, you know, the latest ILO study that focuses on vulnerable groups, you would say 64% are in the informal economy. Too long of an answer.
No, thank you, Dr. Leah. It is not. It's very informative. Dr. أحمد, بتحب تزيد شيء؟ اتفضل.
عفوا عامل سؤال بعتذر.
مش مشكلة.
يعني صححت شغلي الدكتورة، يعني هو اللي اجى بالسؤال القطاع الرسمي. ما فيناش نقول القطاع الرسمي، لأن الرسمي بيعمل لنا تشويش في القطاع الرسمي والقطاع الخاص. يعني القطاع العام الدولي بنقول له رسمي والقطاع الخاص، فهو القطاع النظامي، العمل النظامي. صححتها الدكتورة، شكرا لها. فإذا بدنا نحكي على، يعني نحن عندنا كمان شكلين نشيل غير النظام، عندنا شركة غير نظامية وعندنا عمل غير نظامي. لأنه ممكن يكون عندنا شركة نظامية بتدفع ضرائب ومسجله الى اخره، بس عندها قطاع كبير جدا من العمال غير مسجلين في الضمان ولا يترتب على عقود عملهم اي ضمانات او حمايه اجتماعيه بالمطلق، فهذول صاروا خارج اطار الحمايه اذا نحكي بهالمعنى. هلا اذا مين هن هذول الشيء النظامي بالتحديد بدنا نقول مين هن، اذا كان صاحب السؤال اللي بده يوصل لهالنقطه لهي، انه في عندنا كل موظفين الدوله، شو بدنا القطاعات العسكريه والامنيه والى اخره عندهم انظمتهم، في القطاع الدولي اللي بيخضعوا المرسوم 15 بعتقد اللي هو بيحدد نظام الموظفين عندنا في لبنان، اللي في عندهم ضمانات وتعويضات وتقاعد والى اخره، انما على هوامش القطاع العام في عندنا كل المجاورين والمتعاقدين اللي ذكرتهم بحديثي الاول. عندنا على مستوى القطاع الخاص تماما اللي تفضلت فيه الدكتوره، اللي هو عقود العمل الدائمه المترتب عليها ضمانات اجتماعيه وحمايه اجتماعيه، موظفي المصارف، موظفي معامل، يعني اي مؤسسه بالاخير عقد العمل كثير واضح وعم يترتب عليه هذه الحمايات، بياخذ ضمان، بياخذ تعويض، بياخذ الى اخره، طبابه، للمسائل هي كلها سوا. فهذا هون اذا بدنا نعدهم، يعني صاحب السؤال نعد له اليوم فينا نعدهم، يعني مش انه بس بياخذ شويه وقت، يعني بس نحن فينا نقول المعيار القانون يعني بشكل خلفيه للتصنيف بهالمعنى.
Okay, شكرا دكتور أحمد. I think we have a few more minutes for another question from Jose. He says, the missing middle seems to be a rather broad and heterogeneous category. I'd imagine there's quite some variation in terms of vulnerability, income levels, and so on. If you would have to prioritize extending protection to a certain group of workers, which group or groups do you think should be addressed first? Is this more realistic than granting some form of protection to all informal workers? Please go ahead if you would like to respond to our speakers.
دكتور أحمد بدك أنا جاوب؟
ما بعرف، يعني برأيك دكتورة ليا، هل إنه بتيجي العدالة بالتقسيط مثلا، يعني إنه بنقسطها؟ إنه بنعطي نص عدالة وربع عدالة، إنه يا في حماية يا ما في حماية، بعدين إنه لا بدنا نعمل قطاعات في الحماية الاجتماعية الشاملة للجميع. يعني بعدين هذه نحن عم نطالب فيها كشبكه ماي ورك ماي رايت. بتصور يعني التواصل نحن والاي ال او في ارضيه الحمايه الاجتماعيه في لبنان، في بتكون شغله شامله. هلا كيف بنحصل اي قطاع بيحصل قبل، اذا وقفت علي انا وليا بتصور بنقبل بالكل، بس هي هذه بالاخير توازن قوى معارك وضغوطات والى اخره، يعني في مصيبه. بس المنطق يقول ما في منطق بيجي بيقول والله هذه فئه قبل هذه وهذه بيسوى قبل هذه، يعني انه ما بعرف شو رايك ليا.
لحظه عم بشاهد. Where is my screen? Okay, ما بعرف إذا فيكم تشوفوا. Can you see the screen? Yes. Okay, so this is what Dr. Ahmad was referring to, الأرضية الحماية الاجتماعية or social protection floor. So this is a very good question. There is no one solution, but in the case of Lebanon, the ILO has also produced a report on how to create a social protection floor. And when we mean floor, it mean the minimum, the level of the floor, the minimum protection of workers to the maximum number of people. So this is recommendation 202. So we have to find a way to protect people at the minimum as much as we can, and then we can start building up our protection through, it's a combination of social assistance and social insurance. So social assistance non-contributory and contributory. So here you can say this is a potential inclusive system that you see in front of you, where poor people or vulnerable groups can be targeted by poverty assistance, safety nets that would provide the last resort protection. We can at the same time combine this with universal life cycle guarantee to the people in the middle. We can, improve mandatory social insurance to achieve higher level benefits for those who are enrolled in the formal, and probably, include people who are close. But as I said, there's already an attempt to see how can we include agricultural workers that are the most vulnerable, but, that they are provided for in the social insurance law. And people can also, top this up with additional income to improve adequacy. So this is kind of like how we can cover protection to all. There is no priority, I would say, but more of an integrated approach, again, a double track approach to be able to cover everyone to the minimum.
Thank you for the answers provided. I think we're gonna take a couple of minutes more, maximum, let's say between 3 and 5, because we are receiving some questions. Another question from Hala Bijani: is there any evaluation of what would be the annual cost in Lebanon to extend basic social cover or universal coverage to all residents in Lebanon? And how realistic is it when we do not have the means to know who is truly resident versus non-resident in the absence of census? Can we have a brief response, please?
There is, I'm just trying to copy it from the chat, just a second. So there is a, I don't know, it's not covering probably. Okay, I will just send it later on. Hi, Hala. There is an estimation of the cost, but this was before, the big crash. That is in the social protection floor report that I will try now to copy in the chat, and you can see there was like an estimate how much, and roughly, I will not say it, I'm not sure of the numbers, but an estimate of the percentage of money that was spent on the subsidies before the removal of subsidies would be enough to provide certain social grants. But I don't know why it's not copying.
Thank you, Dr. Leah. Are you referring to the report? Can you tell me the title, because I think the link was already.
It's Social Protection for Lebanon.
Okay, thank you. I will conclude with the last question. Maybe Dr. Ahmad would like to provide us with a response from Amal Karake. Thanks to both speakers for.
ستيفاني ممكن.
تفضل اكيد.
لا بس بدي اضيف شغله، يعني صعب السؤال انه قد ايه بتكلفنا. انا بس بدي اقول شغله بسيطه، انه الضمان الاجتماعي له ديون عن الدوله ما يفوق ال 5400 مليار مش عم تدفعهم. يعني في صناديق ضامنه ممكن يكون عندها امكانيات لكثير من السياسات، بس عندنا مشكله بطبيعه النظام، وعندنا بالانهيار المالي انه بالاخير اللي اخذوا، يعني بالاخير يعني كان الضمان الاجتماعي الدائن الاكبر لكثير من المؤسسات، من الجامعه الامريكيه للدوله لغير في مال، وبعدين ان يتوفر مال اكيد يتوفر. هلا يعني شكرا لي، لاني صراحه ما عنديش رقم قد ايه الكلفه، بس يجري الحديث كثير عندنا بلبنان عن الكلفه الباهظه للطبابه. بسبب تعدد الأنظمة. أنا ما عندي رقم يعني. شكرا لليا إنه عندها شيء هيدا يعني، بس هالملاحظة حبيت أقول يعني.
Shukran, Dr. Ahmad. Let us conclude with the last question. Thank you for the participants for being interactive and engaging, but because of the strict timing that we have, I will conclude with the last question from Aman, asking, in light of the existing strenuous economic situation, could the speakers share with us what immediate action that should be taken by the 3 pillars of labor to elevate the impact of the existing situation on informal as well as formal laborers? Also, do you think that the absence of representative and effective labor syndicates has directly and indirectly contributed to the deteriorating workers' condition? Please go ahead very briefly.
Very briefly, the first thing we have to do is a tripartite dialogue between the 3 entities, these 3 constituencies. This dialogue is necessary to move forward. And the second, definitely the fact that, as I said before, the representation and association of workers is necessary for their demands, for the demands of their rights. And in turn, if this does not exist, of course, there's an impact on their working conditions.
Thank you, Dr. Leah. تفضل دكتور أحمد. بتحب تزيد شيء؟
أكيد يشكل مسألة عمل النقابة والنقابات وغياب نقابات ديمقراطية تمثيلية حقيقية فاعلة حجر الزاوية والخسارة الكبرى للقوى العاملة في لبنان. لأنه هلا إذا بدنا نتحدث، هذا يمكن بده لقاء قائم بحد ذاته لنتحدث عن النقابات والاتحاد العمالي العام في لبنان، اللي هي بالأخير باختصار شديد جدا هي غير ممثلة لأنه لا تتجاوز بالإحصاءات 4-5% المنتسبين. هي غير شرعية لأنه ما يعني آخر انتخابات عملوها 4-5 اتحادات مش عاملين انتخابات راحت شاركت بالانتخابات. إنه بالأخير هي نقابات بيقولوا عمالية بس هي يافطة لتمثيل مذهبي طائفي وليس لعمالي بالمطلق. فعندنا حالة دمار وفراغ بهذه المستوى، وهذه من المعضلات الكبرى في واقعنا اللبناني وواقعنا الاجتماعي والنضالي. طبيعة هذه النقابات موجودة. أكيد بنأكد على صاحب السؤال إنه هل تشكل؟ أكيد بتشكل ضياع يعني نقطة ضعف كبرى جدا واقع النقابات، والاستعاضة عنها بدها جهود جبارة جدا لنقدر نبني. وبالمناسبة مش بس يعني بيسوى نقولها كمان، لأنه اشتغلنا نحن على كمرصد وجزء من شبكة ماي ورك ماي رايت على تأسيس اللقاء التنسيقي من أجل نقابات حرة. نعمل بهاللقاء هذا. أكيد أنا مش عم بطرح حل إنه نحن نحل القضية، لا، نحن مش ما بنحلهاش ولا بإيدنا ولا بنقدر ولا إمكانياتنا لا كمرصد ولا كبس، لا ممر للمجتمع المدني كي يزيد مساهمته في يعني الاهتمام بقضية العمل النقابي والانخراط فيه. اللي عم نخوض فيها معركة أولى ضد شرعية هذا الاتحاد العمالي العام، وخط آخر دعوة لتأسيس نقابات حرة بذات الوقت. أكيد هذه معضلة كبرى عندنا نحن في لبنان. شكرا.
شكرا Dr. Ahmad. Allow me again to thank the speakers today, Dr. Ahmad Dirany and Dr. Leah Khater, for their precious insights. And also I would like to thank the participants for their active engagement. And I would encourage you to follow the next webinars, which are going to be posted and are going to take place in the coming months under the framework of our social justice program, which the center is working on. Also, if you would like to check again this session, I remind you that it will be available on our YouTube channel in a few weeks at the latest. Thank you again for the speakers. Shukran, Dr. Ahmad, and thank you, Leah, and have a nice day. Thank you. Bye bye.
Thank you, Dr. Ahmad, and thank you to the language platform.
شكرا لك ولزملائك، وشكرا للحضور، وشكرا دكتورة ليا أبو خاطر. شكرا. على أمل أكيد نتواصل نكمل ورشتنا من شان 26.
أكيد
نتواصل اليومين مع بعض. شكرا للجميع.
Thank you. Bye bye. Thank you. Bye bye.